In the early 1700s, John St. John rises to infamy in London by claiming the ability to heal serious wounds without ever making an incision. Nicknamed the Bloodless Surgeon, St. John draws crowds and curiosity as word spreads through London newspapers. 17 separate endorsements appear in print, yet not a single formal medical exam backs his supposed talents. He charges £20 per visit, a steep fee in 1700, insisting on cash paid up front for his miraculous services. Because no patient witnesses an actual operation, skepticism mounts quietly among London's legitimate physicians. It's not hard to see why. Average surgeons in that era earn far less per procedure. The situation unravels in 1707 when details about St. John's background fail to match up and dissatisfied patients begin to voice their doubts. With mounting pressure and rumors swirling, St. John abruptly vanishes from the city, leaving no trace and no refunds for the hopeful clients he left behind. His rapid disappearance sparks wider distrust and leads authorities to scrutinize similar miracle healers in subsequent years. The St. John case sets a template for future medical hoaxes, where showmanship, selective endorsements, and the promise of miraculous results routinely outpace real evidence. This legacy soon inspires a new wave of fraudulent medical miracles, each with its own twist on public deception. Radithor. In 1925, a new tonic called Radithor appears on the American market, advertised as a cure-all and boasting radioactive properties. Bottled at $1 per dose, a significant sum for the era, Radithor quickly gains traction, propelled by sensational claims and aggressive marketing. By the early 1930s, over 400,000 bottles have been sold across the United States, as consumers seek relief from everything from arthritis to fatigue. This product, developed by William Bailey, is not approved by any recognized health authority, yet the promise of energy and healing overrides skepticism among desperate patients. At the time, public knowledge about the dangers of radioactivity is limited, and trust in modern science runs high. The turning point arrives with the case of Eben Byers, an industrialist and sportsman who consumes over 1,400 doses of Radithor between 1927 and 1930. Byers' health declines rapidly. Medical investigators later report that his bones literally glow in the dark due to radioactive poisoning. His death in 1932 shocks both the medical community and the general public, providing irrefutable evidence of Radithor's harm. In response to the scandal, the U.S. government passes new labeling regulations for health products, and the FDA intensifies its scrutiny of miracle cures. The fallout from Radithor shapes the standards for drug safety and labeling, paving the way for tighter federal control in the decades that follow. Miracle Mineral Solution. In 2006, Jim Humble launches Miracle Mineral Solution, MMS, a product that he markets as a universal cure for diseases as serious as AIDS and autism. The main ingredient, sodium chloride, is chemically similar to industrial bleach and, when mixed with an acid, produces chlorine dioxide, a dangerous disinfectant. Despite repeated warnings from health authorities, Humble's product reaches customers in more than 28 countries, with online sellers claiming thousands of satisfied users. By 2019, Amazon bans MMS after reports link it to 4 deaths and dozens of hospitalizations in the United States alone. Some promoters even create a church to dodge legal restrictions, arguing religious freedom as a defense. National health agencies issue increasingly urgent alerts, and the FDA targets distributors with warning letters and legal action. Yet the cult-like following behind MMS adapts, shifting sales to encrypted online platforms and private Facebook groups. The global spread of MMS highlights the challenge regulators face when pseudoscientific cures use digital tools to outpace traditional enforcement. calls for stronger internet oversight and harsher penalties grow louder, just as the next wave of fake remedies begins to surge. Fake cancer cure rush. From the 1930s through the 1950s, a wave of fake cancer treatments, including Laetrile, hoxy and black salve, spreads rapidly in the United States. The FDA receives over 3,000 scam cure reports in 1949 alone, as desperate patients and families turn to unproven alternatives. Laetrile, marketed as a vitamin-based cancer cure, gets banned by U.S. authorities in 1977, but continues to circulate on the black market for years after. Meanwhile, Norman Hoxsey, the self-styled cancer healer, spends 132 days in court fighting government efforts to shut down his clinics, never serving jail time. Some Hoxsey therapies are rebranded as herbal teas and sold legally even today. Pressure mounts as cancer rates rise and public confidence in conventional medicine wavers. The proliferation of fraudulent cures prompts a major shift in FDA enforcement strategies, including tighter regulations and public education campaigns. The enduring popularity of alternative cancer miracles demonstrates how hope, misinformation, and regulatory loopholes can intersect. This struggle with health misinformation sets the stage for the explosive growth of vaccine denial movements in the decades ahead. Anti-Vaxxing's Patent Zero. In 1998, Andrew Wakefield, a British gastroenterologist, publishes a study in The Lancet that links the MMR, measles, mumps, rubella vaccine to autism. The paper, based on a review of just 12 children and lacking valid scientific evidence, quickly triggers international alarm and media frenzy. Vaccination rates in the UK and several other countries begin to fall, as parents grow wary of potential risks. In 2010, after years of investigation, The Lancet retracts Wakefield's study and the British General Medical Council revokes his medical license. Wakefield moves to Texas, where he continues to promote anti-vaccine views. Despite the discrediting of his research, Wakefield's claims fuel a global anti-vax movement, drawing millions of new followers. Disease outbreaks that were once rare, like measles and mumps, begin to resurface in developed nations. The Wakefield case marks a pivotal turning point in the history of medical misinformation, as social media amplifies fringe beliefs into mainstream panic. These cascading effects set up the conditions for later public health crises, such as the mass hysteria around swine flu vaccination. The swine flu hysteria. In 1976, fear of a possible swine flu epidemic prompts the U.S. government to launch a $137 million emergency vaccine program. Over a 10-week period, 45 million Americans are vaccinated, even though only one actual death from swine flu is ultimately recorded nationwide. The program results in 532 cases of Guillain-Barré syndrome, a rare neurological disorder, raising widespread concerns about vaccine safety. Public trust in health authorities takes a significant hit as critics point to the disconnect between the risk and the response. Media coverage of side effects overshadows the minimal threat posed by the virus. Congressional hearings and investigative reports follow, leading to new protocols for vaccine approval and crisis communication. The lessons learned from the swine flu campaign shape how future health scares are managed, underscoring the importance of transparency and risk assessment. These events also create fertile ground for skepticism and conspiracy theories, fueling controversies about vaccination for years to come. The environment is ripe for the next chapter, the rise of unlicensed doctors and sham medical practices. The fake doctor. In 2017, Malachi Love Robinson, a teenager from Florida, opens a clinic and poses as a licensed physician at just 18 years old. Over several months, he treats 86 patients, including one woman he diagnoses with arthritis after searching her symptoms on Google. Love Robinson accepts payments for office visits, lab tests, and prescriptions, ultimately stealing $35,000 from unsuspecting clients. His scheme unravels when a patient contacts authorities after questioning his credentials. Media coverage dubs him Dr. Love, and his story quickly goes viral. Love Robinson is arrested, convicted, and sentenced to 3.5 years in prison. The case draws attention to gaps in the regulatory system that allowed an unqualified individual to operate a medical business. State health boards institute stricter verification protocols and public education about the risks of unlicensed practitioners. As attention fades from the courtroom drama, a new medical hoax emerges, this time targeting the public's obsession with rapid weight loss. The tapeworm diet. Early in the 20th century, tapeworm diet pills are advertised in newspapers and magazines as a miracle weight loss solution. The pills contain live tapeworm larvae, which, once ingested, can grow to several feet inside the human intestine. Despite the obvious health risks, the tapeworm diet gains popularity, and the product remains legal until the FDA bans it in 1927. Medical literature records dozens of cases of serious complications, from intestinal blockages to malnutrition, attributed to the practice. Decades later, tapeworm diet fads occasionally resurface, especially on social media. Today, tapeworm diet challenges and miracle weight loss products still appear on online forums and TikTok, recycling the same pseudoscientific claims. The persistent appeal of risky shortcuts underscores the ongoing need for health literacy and regulatory vigilance. As the Internet amplifies such fads, new fears about vaccine technology and government surveillance begin to capture public imagination. Vaccine chip panic. In 2020, widespread rumors claim that COVID-19 vaccines secretly contain microchips designed for surveillance and population control. A national poll shows that 27% of U.S. adults believe this claim or are unsure about it. In reality, no COVID-19 vaccine nor any other has ever included a microchip or tracking device, and manufacturers issue repeated denials. Bill Gates becomes the face of the conspiracy, his name trending across major social media platforms as a meme scapegoat. Fact-checking organizations and 14 news outlets release high-profile debunks. Despite clear evidence to the contrary, misinformation spreads faster than official corrections, influencing vaccine hesitancy and public discourse. Health authorities invest in large-scale public awareness campaigns, aiming to restore trust and combat falsehoods. The episode highlights the unprecedented speed and scale at which viral hoaxes now travel, an escalation mirrored in the world of celebrity-endorsed fake medical cures. Fake cure celebrities. From the 1980s through the 2020s, a parade of celebrity influencers, including Gwyneth Paltrow, Dr. Oz, and various YouTube personalities, endorse so-called miracle products. Examples range from $250 jade eggs and energy stickers to detox teas and pseudoscientific supplements. In 2018, Goop, Paltrow's wellness company, is fined $145,000 in California for making false medical claims. Congressional hearings in 2014 put Dr. Oz's promotions under national scrutiny, while the FDA issues repeated warning letters to health influencers. Many of these products are still widely sold online. The phenomenon persists because celebrity branding lends credibility and amplifies marketing reach to millions. Regulatory agencies struggle to keep pace, issuing fines and warnings but rarely halting the sale of dubious products. The cycle of endorsement, exposure, and rebranding fuels a lucrative industry built on vague promises and limited oversight. As the celebrity wave crests, a new scam emerges in the fitness and diet market: the keto coffee craze.